Hospital's empty this morning. Of course it would be. It's Sunday at 4:30 a.m. All right, Hospital 2. Gotta enjoy the sunlight when you get it, because when you're on call and you are stuck inside the hospital, you may not see the sun the entire day. So it's a Sunday. So the good thing about being on call on the weekend is you don't have any other responsibilities. We don't have clinic, we don't have
So in this case, today we're going to be excising a lesion on the chin. It's an atypical mole and we're concerned for melanoma. So that's why we're going to remove it completely and send it to the lab so that the pathologist can evaluate it further under the microscope and in about a week give us results that we can use to give the patient clear margins and a firm diagnosis. So the first thing we do is identify the site, and here you can see the area on the chin. We already cleaned the skin, so now we're going to measure the area, and in this case, it's 0.6 by 0.8. We're going to take 5 millimeter margins. So what that means is we're taking 5 millimeters of skin that looks normal around the lesion. So now we have the lesion in the middle, and the outer circle is the margin. You cannot suture a circle into a line. You have to essentially turn the circle into an ellipse. Then you can suture this into a nice smooth line. And these are the two puckers that we have to trim out so that the skin can come together nicely into a smooth line. We put a nick at the very top to orient the lab as to which way's up and which way's down. After we've identified and marked the lesion, now we're going to anesthetize the area. So after we've marked, numbed, and cleaned the area, the first thing we do is go right along the outer line. As I mentioned previously, we put a nick at the top to orient which way is up. And we go down to the level of the fat, which is the layer right underneath the skin. That is the standard depth excisions are taken to. Then, using scissors, we loosen the deeper connections. And as you can see, our patient is very comfortable during the procedure. How are you doing?
Fine.
Now that the skin's been removed, we take it and put it in a bottle, and this is taken to the lab. Now, what makes a standard excision different than a staged excision is that the skin is now sutured immediately. The lab will take a week to give us results, but because the cure rates are so high with the margins we drew out, we don't need to wait for the results to come back. Normal areas of bleeding are stopped. There is an odor, and the tool does make a beeping sound. I apologize about the smell. The next step is to suture the wound closed. The skin edges are loosened so that they can freely come together. The edges are trimmed so the skin comes together in a nice, clean way. And then the skin is sutured closed with 2 layers of sutures. The first layer is a deep layer, and this layer dissolves usually in a few weeks. Usually several deep sutures are placed, and sometimes the scar line feels a little bumpy until they dissolve. Once all the deep areas are brought together, the next is the top layer of sutures, and this is the final step. These sutures, which are typically blue, stay in for about 1 week, and then you come back to the office to have them removed. you may be wondering why the line is running up and down instead of side to side. And that is because we always try to orient the lines in ways that are not going to directly be pulling against movement. So the mouth tends to open and close. So if we were to put the line horizontally, we would worry that that would constantly tug against the suture line and would risk an unsightly or spread scar. And after the entire length of the incision has been covered with top sutures, which help align the two edges together, then the next step is to bandage the area and go over wound care. A biopsy that showed a melanoma in situ. We're going to mark the area. For melanoma in situ, we take 5mm margins. So we take our ruler and measure that out. And this number came up from years of studies that show that this is how much skin you need to take to remove a melanoma in situ. With staged excisions, we try to make the shape geometric. This assists the lab in processing the skin. So usually it's in a square or rectangle. So now we have the margin of skin around the biopsy. I also mark where 12 o'clock is. That way, if an edge comes back positive, we'll know which edge to go back to. So the next step is to clean and numb the skin. So after we've marked the area, next we're going to go around the outer edge of the margin. Okay. Once the edges have been scored, then we remove the skin. With melanoma in situ, we go down to the layer under the skin, which is the fatty layer. Thankfully, this is the earliest form of melanoma, so we don't need to go any deeper. Now, paying attention to the 12 o'clock, we put that on a card in the same way, so 12 o'clock is up. Then later I'll ink the edges of that specimen so that the lab knows what is 12 to 3, 3 to 6, 6 to 9, and 9 to 12. If any melanocytes or atypical melanocytes are seen along the edges, they'll tell me exactly which of these 4 edges to go back to so that we can make sure to get clear margins. Those results will take several days, and so this wound will remain clean, but covered and open until we have the results. And normal areas of bleeding are stopped. This step does have an odor, and it does beep, which is not a sign of anything bad. You doing okay? Mm-hmm. Okay, because you're on. Just stop in a few normal areas of bleeding, and then we're all done. Then they also check the center of the specimen to make sure that there's no deeper melanoma than what the original biopsy has shown. So we'll get those results back in a couple of days, and the next step now is to put a bandage on this and go over how to take care of this wound. When we're done removing the skin, we need to orient the skin so that the lab knows what's 12, what's 3, what's 6, and what's 9. That way, when they give us results, they can tell us if any edges are positive or not. So we know that 12 o'clock was up on her leg. This is the center of the specimen. The lab processes that only to look at the depth to make sure that the melanoma in the final excision did not turn out to be any deeper. This is 12 to 3, 3 to 6, 6 to 9, and 9 to 12. So we ink each edge a different color and indicate it on our map. So the first color we'll use is yellow, and we use that to color the edge, the outer edge of the skin. The next edge we'll make is red, so we're gonna make 3 to 6 red. 6 to 9 we'll make green. And this ink still allows the lab to process the skin, and the dermatopathologist, who is the doctor that looks at these slides under the microscope and is an expert in all skin conditions, including melanoma, will still be able to read through the color. Now on the sheet, I tell the lab what color I inked everything so that they know. Then these specimens will be placed in a bottle, and they'll be sent to the lab. Usually the next day is when they're processed. When we get a result back, they will have a separate line for each one of these pieces of skin, and they will tell us whether or not they see melanoma in that outer edge that I inked or not. If there's no melanoma left, then we can proceed with bringing the patient back and suturing the skin closed. If any of the edges still have melanoma, for example, if they saw melanoma from 12 to 3, I would go back and have the patient come in, and we would remove an additional margin of skin from only 12 to 3. We would leave the remaining edges, which are all clear, untouched. This is how the staged excision conserves healthy skin. Once all the margins are confirmed to be clear, then we have the patient, as I mentioned, come back, and that's when we suture the wound closed.
This is a case of a 70-plus-year-old gentleman with history of aortic valve insufficiency, thrombocytopenia together with stage 4 metastatic melanoma, and history of resection of melanoma from scalp with multiple areas of skin graft and also radiation to several regions of the scalp, who developed a solitary brain tumor which was initially treated with immunotherapy. However, he presented with progressive growth of this tumor despite immunotherapy, which resulted in dense right-sided hemiparesis and weakness, as well as expressive dysphagia, speech problems. MRI scan of his brain revealed a large brain tumor in the left frontoparietal region, accounting for his right-sided weakness and speech deficit. Anatomical review using MRI before the operation. On patient's right side, which is the left side of the screen, where anatomy is not distorted, we can readily identify pars bracket, anterior to which is central sulcus, sigmoidal hook sign, and motor strip. Now let's review the MRI slice by slice. Tumor has a lobular morphology with significant local mass effect and edema. Here is pars bracket sign and motor strip. Tumor has completely distorted the anatomy on the left side of the brain. Computer navigation is further used to study the anatomy and plan the approach to the tumor. Superior sagittal sinus and a large draining vein overlying the tumor is identified. Given the location of the tumor, adjacent to motor strip and overlying large draining vein, we planned for awake craniotomy with cortical mapping. Patient's tolerance of an awake craniotomy relies on effective analgesia of the surgical area, which we will review here. Skip ahead if this does not interest you. So after prepping his scalp with chlorhexidine, his scalp was blocked, essentially made numb, by infiltrating local anesthetic agent consisted of marcaine and lidocaine mixture along the course of 7 involved nerves. These nerves are consisted of supraorbital, supratrochlear, zygomaticotemporal, auriculotemporal, greater and lesser occipital, and finally great auricular nerve. Local anesthetic is injected along the dotted line marked on patient's scalp, the skull clamp pin sites, as well as incision sites. Let's have a quick review of anatomy of the blocked scalp nerves, which is quite important. But if this doesn't interest you, please skip ahead. Supraorbital notch can easily be palpated, and this is where the supraorbital nerve can be found. Supratrochlear nerve is just medial to the supraorbital nerve, above the brow line. Blocking zygomaticotemporal nerve involves infiltration at the lateral edge of the supraorbital margin to the distal aspect of the zygomatic arch. Auriculotemporal nerve crosses over the root of the zygomatic process of the temporal bone and lies deep to the superficial temporal artery. Avoid intra-arterial injection. To block a great auricular nerve, inject the local anesthetic about 2 cm posterior to the auricle or ear at the level of the tragus. To block the lesser occipital nerve, infiltrate local anesthetic subcutaneously behind the ear, starting from the top down to the auricular lobule, and then continue to infiltrate along the superior nuchal line. Greater occipital nerve is found about 3 to 4 cm lateral to the external occipital protuberance along the superior nuchal line. While patient is completely sedated, a bone flap is raised over left frontoparietal region overlying the tumor. Patient is then awakened gently and maintained calm and comfortable prior to dura opening.
So we have done the craniotomy overlying the tumor precisely, and we're gently waking the patient up. Dura is a little bit tight, but we want to make sure patient wakes up nicely. And this is the
This is a 20-plus-year-old patient who presented with several weeks' history of headache, progressive weakness on the left side of the body, as well as difficulty with gait and balance. On physical examination, patient was alert and oriented, but had some left-sided hemiparesis or weakness with upper tract signs. Essentially, patient had sustained clonus, positive Hoffman, and Babinski reflexes. A positive Hoffman signs named after German neurologist Dr. Johann Hoffmann. It is suggestive of corticospinal tract dysfunction, which is responsible for voluntary motor function, and is localized to cervical segment of the spinal cord or above. A positive Babinski, on the other hand, is named after French neurologist Joseph Babinski, likewise suggesting of disruption of the corticospinal tract, but anywhere in the spinal cord or brain. MRI scan of the brain showed a large mass at the temporoparietal junction with significant local mass effect and vasogenic edema, thus explaining the neurological findings of corticospinal tract dysfunction and weakness on the left side. Patient was taken to the operating room for surgical resection of this tumor using computer navigation and neurophysiological monitoring with brain mapping. He was positioned supine with shoulder roll elevating the right shoulder and head comfortably turned to the left, exposing the temporoparietal area. Computer navigation was used to localize the tumor, and the incision was planned along a plane bisecting the anterior and posterior poles of the tumor. Here's a view through the surgical microscope. The surgical corridor was optimized for a dissection plane parallel to primary motor and sensory cortex, minimizing shear forces on these delicate tracts during the dissection. Primary sensory cortex is in the anterior and superior portion of the surgical exposure. A circular bone flap was then elevated using a single burr hole, exposing the underlying relaxed dura. This relaxation is of course induced chemically using hypertonic saline and mannitol. Upon opening of dura, the tumor can be easily seen and distinguished from the normal brain. We performed a sleep mapping, delivering stimulus of about 2 to 3 seconds, starting at 2 mA and increased it in 2 mA increments, approximating the posterior border of postcentral gyrus or primary sensory cortex. Sodium fluorescein guided microscopy combined with computer navigation was used to confirm the location of the tumor. Bipolar cautery and microsuction was used to establish a border between the tumor and surrounding brain. Low current bipolar cautery is used frequently to harden the capsule of the tumor, rendering it more distinct than the adjacent delicate brain tissue. Tumor is seemingly removed in one piece in a gross total fashion. However, we are well aware of our blind spot in the inferior border of the exposure and pole of the tumor. Sodium fluorescein guided microscopy showed an area in the blind corner suspicious for residual tumor. This area is further explored and additional tumor is discovered and removed with no injury to the surrounding brain. Hydrogen peroxide solution-soaked cotton balls is laid over the cavity of the tumor resection site for both destruction of neoplastic cells that may reside in the cavity and also for hemostasis. The cavity is also covered with hemostatic agent. Duro is reapproximated and duroplasty completed. The bone flap is reapproximated and the border between the bone flap and the cranium is covered with synthetic agent to achieve a better cosmetic result. Patient had no neurological deficit and was discharged home. Post-operative MRI scan of the brain immediately and approximately a year after showed no radiographic evidence of residual or recurrent tumor. The pathology of this tumor, unfortunately, was glioblastoma multiforme with MGMT promoter methylation and IDH1 or IDH2 mutation not detected. Thank you for watching, and as requested, this was a longer video than usual.
Τελικά. This is the sternum, okay? This is the pericardum. Το πάνω. So we open the pericardium.
So is this to mark the structures?
Αεριών.
Το LV Κυριακό. That's the solution to the coronary ostia. Όχι και την πληγία.
Και μέσα παίρνει.
Where when I empty the heart?
Λοιπόν, δώσε μου μία ρούφων. Puoi guardare ora. Per non coronare.
In this video, we're going to show you real surgical footage of how we removed a bullet from a spinal cord. This video has graphic surgical footage, so please do turn away if you are squeamish or under the age of 18. We're going to show you how a laminectomy is done and how we removed a bullet from inside a spinal cord. So let's get to it. Cases like this require an experienced theatre team who'll get things like the exoscope and all the operating instruments set up. Everything needs to be like a well-oiled machine and running smoothly. So whilst we get the first X-ray to show us exactly where we think the bullet might be, we start to prep and drape the patient and get everything ready for surgery. Here you can see the exoscope getting into position and we're ready to start. Please do remember that this is real surgical footage, so turn away if you're under 18 years old. We start by marking the back where we think that the bullet's going to be, and then we prep and drape with these blue sterile drapes. Next, we put something called IBAN on, which has got antibiotic, which is an antiseptic film, which protects the patient and us. We get all of our instruments ready before we make the first cut. And here you can see the exoscope being wheeled into position. So we make the initial cut that goes through the skin and the fat that's just underneath it. Next, we need to spread the skin apart to give us some better access to the tissues underneath. After this, we're going to use this white instrument called a monopolar, which burns and cuts through tissue, and it seals off any bleeding arteries at the same time. This helps give us a nice, clean dissection through the muscles and stops it being very bloody, which will obscure what we're trying to see. At this point, we're trying to strip off the muscle from the bone. This swab will go in and help peel away any remaining muscle from the tips of the bone there. The patient's head is towards the bottom of this image, and we can see the spinous processes of the spine, and these are the bits that you can feel on your own back. We're going to put a metal instrument on these spinous processes, and we filled the hole with something called betadine to keep it clean, and we'll cover it up and then take an X-ray to see exactly where we are. And this is the X-ray machine coming in now. On that X-ray, we can see the bullet lying right in the middle of our operating field, so we know that we're going in the right direction. So now we need to get all of this bone off, and especially in the thoracic region or mid-back, the bone can be really tough, especially in younger patients. There's a lot of work that needs to be done here with quite crude-looking large tools, and then eventually we're going to go towards using a drill to help make this job a bit more quick and efficient. But at the moment you can see we're doing the bulk of the work with these rongeurs, which are just chewing away and biting away at the bone. Now you can see the drill being used, and this is making a gutter on either side of the spinal canal, and we're going to use that as a way to get into the spinal canal. Lots of drilling needs to be done at this point. But once we've made a tiny entry point, we can use these kerosene rongeurs to just start chewing away safely at the bone and give us some access to the dura and the spinal cord underneath. Remember, the dura is the leathery outer covering of the spinal cord that you can see right here. We've got quite a large area of bone that we've taken off. The spinal cord will be under this dura, and now we need to prepare to cut it open. So we take a scalpel and we make a cut in the middle. There are 2 layers to the dura, so we just need to make sure that we go through each one of them without going into the spinal cord underneath. At this point, once we've made a small hole, we can use what we call blunt hooks to just gently tease open the dura from end to end. And underneath that, we have the spinal cord. A bit of bleeding is to be expected, and that will come from the dural edges. So because these edges are in the way, we take these tiny little stitches, and remember, we're doing this under a microscope, so these are very, very small stitches indeed. And we'll use these to hitch the dura away from the spinal cord and anchor it away. This is a slightly finicky process and can take a little bit of time, especially tying off these stitches with instruments. So once we've done that, we've got the spinal cord underneath. Remember, it's quite damaged because there's a bullet lying in the middle of it that's come in with high velocity and caused a major amount of trauma here. We need to make a small cut bang in the middle of the spinal cord where we think the bullet is. With the sucker in the left hand, we can feel that the bullet is a lump just underneath where we're making that cut. We're using a blunt hook again to just pry open this window we've made into the spinal cord. And at this point, we start to see a small glint of what might be the bullet. And there you can see it shining under the light of the exoscope. We'll make this hole slightly bigger, but just big enough to allow the bullet to be removed. And there we can see it. And now we're going to take it out.
These will grab the edge. Grab all of it. Go for it, yeah, grab it. Yeah. Here she comes. Do it again once more, just in case we missed it. Yeah, sorry guys.
So that's a 9mm round that we've retrieved. So after that very satisfying bullet removal, we still need to close up what we've done. The dural edges need to be close together because apart from the spinal cord lying in there, there's also CSF or cerebrospinal fluid. If this keeps leaking out through a defect that we've made, it can cause the wound to not heal properly. On top of this closure, we put something called Duraseal, and this is an artificial glue that helps seal everything off. The next thing to do is we tunnel a drain in to let any excess blood out because we don't want that to compress the spinal cord. After that, we'll stitch up the muscles, fat, and skin and take the patient back to recovery or the ward or intensive care or wherever they came from. So that video showed you how we can remove a bullet from the spinal cord. Hope you found it useful. Some of the things that we've done in there, including the laminectomy or removing the bone, is part of most operations that we do when we need to access the spinal nerves or spinal cord. If you've enjoyed that video, please do like, subscribe, and leave a comment to let us know what you'd like to see in future. Thanks a lot for watching and see you soon.
Just going to walk you through this one step at a time. Very, very easy. Just keep listening to me. You'll know everything you need to know. Very, very easy. Okay, so if you open your eye there and look straight, you'll see a white circle. You just look at that. I'm just going to hold the lashes. You're looking straight. If I block the light, you're still looking in that direction the whole time. So a little eyelid holder, very strange at first. Keep looking straight. Just widen this up a little bit. In about 30 seconds, you won't even know it's there, as strange as it feels at first. Now you're just looking straight there, just slowly bringing you closer. In the center there, you'll start to see that there's a green flashing light. You look at the green light. I'm going to bring it nice and close, and I'm going to make it go sharp. And when it goes sharp, you look straight at it, and you feel that little pushing on the eye for about 20 seconds. Nice and steady, right at the green light there, nice and steady, a little pushing like that, breathing gently, holding steady. Perfect. Now, if the light shifts, don't follow it, just look straight past it, out into infinity, breathing gently, holding steady. That's perfect, beautiful, excellent, super. All fuzzy, just memorize where you're looking, nice and steady, that's perfect, perfect, and we'll take the pressure off. Fantastic, super, excellent. Let me just take this out for you, that's great. And close the eyes. That's super. So that's the hard part. So as you see, even the hard part is very, very easy. MOS. Super. Okay, a little tape on here. We'll just take the tape off. Tilt your head over to this side. And just resting there, we'll take the tape off on this side. And just as you are there, a little extra drop here. And you're looking towards the circle there. A little eyelid holder here. Everything's exactly the same. The only difference is that people think they're feeling a little bit more on the second eye just because you're expecting it. But everything's exactly the same. You're looking towards the center there. And I'll put the green flashing light on in a second. And that's right, you just look straight at it. The same thing again, that green light. It's going to go sharp. And when it goes sharp is when you look straight at it. Right at the green, little pushing like that. Breathing gently, holding steady, breathing gently. Perfect. The same thing again, don't follow the light, just look straight past it, out into infinity, breathing gently. Perfect. Perfect. The clouds are coming in, it's going to go all fuzzy. Just memorize where you're looking, nice and steady, that's perfect. 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 And we'll take the pressure off. Super. Great. In a minute, we'll swing you around to the other side of the room to do part 2. Everything's going perfectly. Super. And let's close the eyes and just rest here. I'll leave you here with Susie for about a minute. Okay, very good. Super. A little tape on here. Drop. That's right. That's beautiful. Little extra drop there. And you're just looking straight ahead here. There's another white circle, another green flashing light. You're just looking straight ahead there. Little eyelid holder here. Keep looking straight. Very good. Perfect. Beautiful. That's great. And just as you are there, nice and steady. Very good. Little push in here. That's right. Perfect. Very good. Little fluid here. Nice and steady. That's beautiful. Perfect. And you're just looking straight ahead into the center of the green flashing light. The light goes red. And you're right in the middle there. Very good. Super. Excellent. That's great. And just as you are. D. Down to 1. A little wet sponge here. Keep looking straight. And a little pushing here. Nice and steady. Very good. Nice and steady. That's beautiful. Excellent. Super.
Perfect. And everything goes very blurry, nice and steady. That's beautiful. Super. Towards this flashing green light in front of you there. That's right, that's perfect. Keep looking straight. And just blocking your view a little bit here, nice and steady. That's super. Just relax the chin. The light goes red. Everything. That's right, that's perfect. A little buzzing now. And lots of flashes of light. And your job is just to continuously look into the center of the flashing, just as you are there. Perfect. Perfect. Beautiful. Excellent. Super. Perfect. 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 Fantastic. Excellent. And just as you are there, keep looking straight. That's beautiful. Little fluid here, nice and steady. That's super. Keep looking straight. Very good. That's excellent. Little rush of fluid. A little steady. Very good. Super, just as you are there. Very good. Super. Excellent. Okay, so that's one eye done. Everything's perfect. You surviving okay? All right, everything's going perfectly here. Very good. Little drops there. Super. And just, that's great. And close the eye. That's super. Excellent. Little tape on here. Great. And I'm just going to take the tape off here. And just relax the chin, relax the neck. That's right. A little extra drop here. And you open the eye on this side. I'm looking straight ahead there. That's perfect. Little eyelid holder on this side. That's great. Keep looking straight. Beautiful. Perfect. And just as you are there, a little pushing here, nice and steady. Very good. That's super. A little fluid. Very good. And concentrating in the middle of the green flashing light again, right in the center there. Light goes red. Perfect. Very good. Very good. That's super. And just as you are there, S. A little wet sponge here. Keep looking straight. Very good. A little pushing here again, nice and steady. That's beautiful. Super. Very good. Excellent. Perfect. Everything goes very blurry. Nice and steady. That's fantastic. Just as you are there. Beautiful. Perfect. And just blocking your view again, nice and steady. Super. That's great. And the light goes red. You're going to hear the little buzzing again. You'll see lots of flashes of light. And your job again is to continuously look into the center of the flashing cloud. That's perfect. Perfect. Very good. Excellent. Super. Perfect. 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 Fantastic. And just as you are there, keep looking straight, nice and steady. That's beautiful. Steady as you are there. Perfect. Keep looking straight. Very good. Little rush of fluid again. Hold steady. Very good. Keep looking straight. That's excellent. Super. Perfect. Fantastic. Okay, that's 100% totally perfect in both eyes, Alex. It'll be healed in a few hours. Not too bad for you?
No.
Nice and easy? You feel anything?
No.
Certainly no pain, right? Yeah. Okay, close the eye. Very good. Excellent.
Buck, and I've been a dentist for 15 years, and I've been removing wisdom teeth for 13 years. You are about to see how I extract these 3 wisdom teeth, including this impacted lower one. So like and subscribe if you have teeth.
Spinal schwannomas. This is a case of a 40-plus-year-old gentleman with history of pain and electric shock sensation in his back, buttock, and lower extremities, which was worse at nights. This was together with weakness of both legs and also chronic constipation, who after several visits to the emergency room eventually had an MRI scan of lumbar spine with the following finding. MRI scan of his lumbar spine showed an intraspinal, essentially intradural extramedullary tumor with cauda equina pushed dorsally. By the way, cauda equina is a bundle of nerve roots which is at the end of the spinal cord, and the meaning of the cauda equina in Latin is that of a horse's tail. This is due to resemblance of this bundle of nerve roots coming from the conus or the end of the spinal cord to horse's tail. He was taken to the operating room for surgical resection of this tumor, the view through the surgical microscope. In the operating room, he underwent standard bilateral laminectomies, achieving wide lateral dural exposure. This is with minimal manipulation and delicate preservation of the facet joints to mitigate spinal instability or deformity in the future. Nerve roots can be seen through the nicely exposed translucent dura, but not the tumor, which is covered by the nerve roots. Intraoperative ultrasound is a helpful adjunct for localizing the exact position of the tumor. It was used to examine the adequacy of the dural exposure before the dura was opened. The dura was opened sharply at the midline. Effort is made to preserve the arachnoid. However, as you can see, not entirely successful every time. This is to prevent bulging of the nerve roots into the surgical field. Retraction tack-up sutures were used to mobilize the dura laterally, thus increasing the surgical exposure and reducing the possibility of epidural venous hemorrhage. You can see that the bundle of roots of the lumbar and sacral spinal nerves, otherwise known as cauda equina, were under considerable pressure by the tumor. They were completely covering the tumor capsule. Extramedullary tumors located around the cauda equina can pose a significant surgical challenge due to their often adherence and at times engulfing the nerve roots. Overlying arachnoid band is incised and opened carefully, and nerve roots were carefully dissected and mobilized away from the posterior capsule of the tumor. Intraoperative neurophysiological parameters such as motor evoked potentials, somatosensory evoked potentials, and free-running EMG of the major sensory and motor pathways are carefully monitored during this step. It is noteworthy that this tumor most likely represents a schwannoma, which almost exclusively arise from the dorsal or sensory nerve rootlets. We will have a brief review at the end of this presentation, but here's a quick review of the anatomy and the pattern of the growth of schwannoma. As mentioned, They typically arise from the dorsal or sensory nerve rootlets and gradually grow. With careful dissection, we may be able to preserve both motor and sensory function of this patient, as the tumor typically arises from a single rootlet, and that rootlet may be non-functional, or there may be overlapping or redundant function in the other rootlets, which we need to preserve. Exposed dorsal pole of the tumor is carefully isolated from the adjacent nerve roots by cottonoid patties to prevent heat transfer by low current bipolar. Low current bipolar cautery was used to devascularize a safe portion of the tumor, which was then opened sharply. Ultrasonic aspirator was used to carefully emulsify and remove the central content of the tumor, thereby reducing its volume and make the exposure easier. However, one should avoid excessive decompression and possible violation of the posterior aspect of the capsule and injuring the posteriorly adherent functional nerve roots. The compressed tumor is gently mobilized for careful inspection of the nerves within the afferent bundle, which at the onset appeared to be non-dissectable from the capsule. However, diligent microsurgical dissection will prove otherwise. Direct nerve root stimulation is used to evaluate the functionality of each nerve root involved. Arachnoid knife is used to dissect functional nerve roots away from the capsule. As the posterior border of the tumor well defined and functional nerve roots mobilized away from the capsule, thus preventing heat transfer and injury to the nerves, ultrasonic aspirator is used to decompress the tumor more. After dissecting and mobilizing away all functional nerves, proximal and distal section of the affected nerve are identified and secured. Tumor is separated from the afferent and efferent segment of the nerve.
Man, I gotta sneeze, but I can't.
DJ Little Dick Adam, the smallest penis DJ, smallest in the world, the smallest penis on the motherfucking planet.
I'm gonna get my balls replaced by turntables.
Oh yeah,
Turntablism. Yeah.
Will your dick be a speaker?
Mm-hmm.
No, it'll be a DJ.
Oh, your dick will play your balls.
Yeah, it's in the booth.
That's cool. Okay.
You get your balls stapled to your lower stomach.
Okay.
Your lower
so
abdomen.
you're gonna put your balls above your dick.
No, just like my dick will be pointed straight up.
Okay.
Mm-hmm.
And then it'll be behind my balls. Like
I see. Yes. Yeah. Oh, so you're gonna maybe put a little bit of ball skin to your stomach to kind of keep them taut.
Yeah, right.
But they will hang.
Sort of. No, they'll be up.
They'll be up. But
But
that's
then my
what
dick will be up.
instead of your lowest ball skin. Instead of
There's no way to have my balls over my
Mm.
dick. The balls would just push my dick up, and then
right.
my dick would.
Well, what I'm saying is you'll staple your nuts probably maybe 1/8 up to where your cock
Ooh,
is.
we talking measurements now, baby? Let's go metric.
1/8 of your cock.
Do I have to listen in the headphones the whole time?
Yes.
Yeah.
I really
Just in
don't like
case.
it.
No, you like it because you love listening to your own voice.
I really don't like
Well, that's
listening
why
to
he
my
won't
own
listen.
voice.
He won't like it because he doesn't talk that much.
You guys both have better voices for radio than me.
That's
I
not
acknowledge
true.
that.
You have,
a
the best,
great voice.
You have the best radio. No, I have a horrible voice, and that's why I'm so good at impressions.
No, that doesn't make any sense. You have a good voice.
I hate my voice so much that I've had to become other people.
You're a professional voiceover artist.
I didn't love my voice, and that drove me.
Yeah.
You're like an ugly bitch that becomes hot.
Kind
She
of,
hates herself.
but she'll always be ugly.
Yeah.
on the
No.
inside.
In my opinion,
she can
that's
never
true.
escape
No,
it.
She was always beautiful to begin with. That's the story.
Nobody ever gets hot. I mean, the ugly duckling should end with that goose killing itself.
Well, that's the thing about the ugly duckling. Because
And then the ugly duckling grew up and it was a fucking heroin addict.
What
and
if it was a fucked up
it
duck?
fucked way too many ducks.
Yeah.
It's just fucked so many ducks trying to just finally feel like a duck 15 years earlier, but it never worked.
Yep. If I was the ugly duckling, that's what
Yeah.
I'd say.
Yeah.
It would be like, to prove to himself that he wasn't a gay little duck in high school, he'll try and fuck a bunch of girls and never actually have a meaningful relationship.
You never hit that number, baby.
Yeah. I'll never not be gay in high school no matter what I do.
So you're just going to be an ugly duck, not a swan?
I am a swan. I'm a big dick swan. But as a big dick swan, I'm using my powers for bad. Why do we have 4 things up? 4 channels up.
It doesn't matter.
It doesn't matter because that's not plugged in.
It's fine as long as it's getting all of them.
Yeah, it's getting all 3
But
channels.
that's what happens when you let Adam press the buttons. You know?
I'm working the levels, baby.
That's right.
Speaking of voices, we did it at both the live shows.
You
Still
want to bring
don't
it
know.
back?
Yeah, why not?
Oh my God. This was.
If you missed out on the live shows, which we won't be posting anymore, and if you want to know why,
We might.
It's because people hate them.
People hate them. So if you want to like search through comments to find people that didn't like the live shows, and then you can send them death threats and hate mail, because
we should
we'll
post
never be posting a
Yep.
live show again.
And
Nah,
then-
fuck that. If you want to see a live show, you can come out and see the fucking live show.
They're
Otherwise-
never as good anyway, but
Yeah, it's a different dynamic.
we're playing to an audience.
Yeah.
Whatever.
I
like to
but
give-
the live shows were awesome, and maybe it'll be more incentive to see the live shows.
Anyways, those guys got a taste of
premium content.
our latest character, Cruisin' Joe List, which is Joe List is a bathroom homosexual.
Predominantly bathroom.
Yeah. Yeah, I just love hanging out in the bathroom. Love going in the bathroom. Yeah, the other week I was at a Pearl Jam concert, and there was a bathroom there. And, I tried to go in, the door was locked. So, I stuck my cock through the, that little slit there where you got, that space, the peek hole. Because it's for peeking, that peek slit.
Yeah, of course.
I lost it. I had it, over the weekend.
No,
It's not about the actual voice. It's about the ethos.
Yeah.
And the cadence of it sounds like Joe setting up
I like the bathroom.
a joke. Yeah.
Sounds like a man's asshole
Sex with a
opening.
Man.
Yeah, no, there
What
was
happens if your dick is too small to go through the hole?
Oh, you open the door a little bit, and then you crush your dick in there.
Oh, okay, cool.
Cool.
I love having gay sex in bathrooms. Has anybody seen Jim 2's?
Yeah.
That was another.
Yeah, I was just following Jim
We were
2's around.
sexually harassing him.
Yeah. Sexually harassing Jim 2. Everybody see that Jim 2's guy? I don't know where he went.
Hey, Jim. Want to go? You should have been drinking a lot. You want me to show you where the bathroom is? I can take you
Love
there.
the bathroom. Yeah, I don't know. Yeah, fuck. I don't know. I had it over the weekend. Now it's gone.
Yeah.
Now, don't forget the master suite, though, dude.
Yeah. No, I don't want to just repeat this. It's got to be organic.
Nah,
Yeah, it has to come up.
The people deserve to hear that.
People don't deserve anything.
Cruising Joe List calls the handicap stall the master bedroom.
People will get.
Was I call it the master suite?
Yeah, I love that handicap stall. As I like to call it, the master bedroom. There's so much space in there. I feel like the King of France.
What's the name of the King of France?
Dominic Strauss-Kahn.
Oh, Dominic Strauss-Kahn. I didn't know that.
Cruising Joe.
Cruising
Yeah.
Joe List.
Joe, we got to do the show. Get out of the bathroom. Joe, get the fuck out of the bathroom. Trying to do a podcast.
No, but there's a lot of good cock in here.
It's weird that Mark's.
You know when you have a friend who just can't stop sucking cock in the bathroom?
Mark's from New Orleans and Joe's from Boston, and neither of them sound like they're from those places. They don't have any inkling of.
Doing Joe has ruined my Mark Norman impression.
You
Now I
had
can't
you had
do
a
it.
fire Mark Norman for a while.
Yeah, I can probably get it back. Yeah.
Get it back, man.
Yeah. He's in there somewhere.
That's good. No, you got it.
It's close.
He's having gay sex.
Yeah, everybody's got a friend named Joe who likes to fuck guys in the bathroom. We got a show to do. I'm like, Joe, where the fuck are you? Joe, where the hell have you gone?
Kidding. I'm in here.
Yeah, you know who probably put him up to
Having
it?
gay
The
sex.
Jews.
Yeah.
It's probably all those Jews convincing him to suck cock in the bathroom. Kidding. Just kidding.
Kidding.
Just kidding.
Love a nice cock.
Yeah, so we had a lot of fun on the road, boys.
Oh,
didn't
yeah.
we?
Mm-hmm.
It was good.
Went to Cleveland, Boston. Thank you to everyone who came the fuck out to the Cleveland, Boston tour. We sucked. We fucked.
We had a couple celebs in the audience.
Yep.
Yeah, dude.
Tony
Ray
Damon.
Fiennes.
Ray finds Perry Farrell from Jane's Addiction.
Tony Damon, Matt Damon's brother.
Tony Damon, yeah.
He was in Boston.
Yeah. And Johnny Damon, former Red
Johnny
Sox.
Damon.
Yeah, and Yankee. Played both sides.
Looks kind of like a caveman. I don't know if that...
We had Kofi Annan's wife there.
She's mourning.
Banana Tutu.
Banana Tutu Annan.
Banana Tutu Annan.
Who's still taking the loss of her husband really
well,
hard.
we comped her tickets because then she's having
She's
a
a
rough
widow
time.
and stuff. Trying to
So
fuck.
I didn't try.
Set her up with a banana split right there in the front row.
Banana Tutu.
The traditional cuisine.
Yeah. Any other fun things? We didn't go to the Rock and Roll Hall of Fame.
Yeah, we didn't.
We gave it a miss.
The Suck Cock and Roll Hall of Fame.
And we would have gone if that was.
I was doing this morning. Here I am. Suck cock you like a hurricane.
It doesn't even make sense.
It does. Suck cock, yeah. Suck cock you like a hurricane. Dude. I'm gonna suck cock you. That's like the way a kid from Iran would say it.
Yeah.
Fuck you! I'm going to suck cock you. Why don't you suck cock me? Why don't you suck cock me?
You know what having gay sex is like?
For you, I have hate. Why don't you suck cock me, ass shit fuck?
Oh, another good song from the road was My Dick is Small. Whoa.
Honestly, dude, we had so much fun on the road.
Yeah.
It was really fun. We shared a hotel room in Cleveland.
Yep. Yeah.
Got our own rooms in Boston.
Own rooms in Boston. I just love the difference between the deal Stav negotiated and the deal I negotiated.
Hey, man.
All right.
I told you to negotiate the deal.
Look,
Nick,
I got Stav a
negotiator.
handicap room in Boston that had its own alarms and bells.
I got
and
that one.
Yeah.
I did my slick talking.
He had a flashy light
at the end.
If you're deaf
I
and you
learned my
can't hear
lesson
the
from that bad
doorbell,
deal.
that concierge was like, "Sir, do you want a room that is for retarded people?
And I was like,
Do you want to be closer to the elevator?"
I did ask for that.
Yeah.
Honestly, though,
That guy
your
had a
boy's
weird
out of the
name.
boot. My foot, every step is excruciating pain, but my doctor says that's what it takes to get better.
You got to work it out because we got a lot of international traveling coming, boys.
We're going. We booked a trip to, and I'll give you a hint. Here's the hint.
We already
I
said
think
on
I'm
the
sucking
podcast.
off gay men. I think I'm sucking off gay men.
Yeah,
I really
people already
San
know.
Francisco.
yeah. Adam's bedroom. We're going to Japan.
We're going to Japan-aroo.
I cannot do it, Haru, to go to my home country.
Yeah. Nick will probably stay because
going
of the
native.
racial homogeneity.
Fuck that, dude. I'm gonna be like Tom Cruise.
Last Sam?
Yeah. Just
Last
getting
Sam.
some.
Last Sam.
Just getting
Witcher
some
eye.
just
That's me.
untouched pussy. Just some field ass pussy.
Mm-hmm.
Just long, flowing, soft pubes. The same pubes she's had since she was 12.
That's right.
You know?
Nary a blade has touched
Nary a blade. Until the samurai comes and cuts her pussy pubes off.
with a fucking.
Which a lot of people don't know this, but the way it's supposed to work is the vagina is sealed by hair.
Ah.
And a warrior is supposed to come through and cut the pussy open with a
With
knife.
a katana.
In Japanese lore.
No, in all humanity.
Oh, really?
Yeah.
Hattori Hanzo.
I didn't know that.
Yeah, you're supposed to use a Bowie knife and just jam it in there.
Huh.
You've been talking a lot about putting knives into pussies.
Have I? No, that was. You know what? You're confusing me with that SVU episode that we watched.
That's true. We
It's
watched
never
like 5
messing.
episodes of SVU.
Oh, yeah. We also watched Senator John McCain
I was laughing
on
about
SNL.
just redoing the intro to SVU. You know, where it's like, in the state of New York, men and women, or women and children, and sometimes even men are held down and fucked at gunpoint. Sometimes people look at child pornography. This is a special type of crime known as rape. Boom, 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 boom. They're just rape. And then the name of the show is Rape. Ban, ban, na, na, na. Yeah.
Fucking my ass.
And the episode starts and it's a construction worker like, yeah, I'm on my fucking lunch break. And then he turns the corner and there's like a 4-year-old getting fucked and he's like, whoa. Bum bum ba ba ba. Yeah. That's the dream as an actor, is to be one of the One of the guys that discovers a rape at the beginning of SVU.
Oh, Maron.
Yeah, I just opened this pizza box and there's a baby being fucked to death inside of it. Look, I don't fucking know. I'm just a New Yorker. Yeah.
Yeah, what was that?
I also love the criminals.
Deborah Messing?
The criminals on that show are always like acting so hard.
Oh, yeah.
Oh, yeah.
It's always the guy that's like, you thought you'd discover my secret.
Yeah.
It's like a guy that just downloads child pornography.
Yeah.
That's it.
That's it.
And he's
It's
pretending
it's
he's
a pretty
Hannibal
big
Lecter.
Secret.
Yeah.
Downloading child porn.
Yeah.
What's a bigger secret you could have than that you are a pedophile?
Being in child pornography.
That's where you got your start as an actor. In child porn. All right, I'm gonna start in child porn, cross over to regular porn, and then I'm gonna attempt a double crossover from regular porn to mainstream porn
Or to mainstream acting. Hollywood acting.
Yeah, from child porn to regular porn to mainstream acting.
A couple people have followed that path.
Wasn't that some lady named Tracy?
Tracy Lords.
Yes.
Yeah, she did real acting.
Straight up
roles.
porno as like a child, right?
Yeah.
It's
Was
pretty
she in
fucked up.
That's
Behind
the Lord's Prayer. Dear God, please let me accidentally discover underage nudity on this website. Because if you accidentally see it, it's not illegal.
Dear Lord,
deliver us.
Accidentally search the name of the woman I know was in child pornography.
If it's not on purpose, ain't illegal, dog.
But if Google hasn't taken it off Google Images, it's not my fault. Amen.
What if the dog's trying to take a nap right there?
She likes napping near us during the pod.
Yeah, she can feel this fucking riffing energy, dude.
I know.
It's electric. Her pussy's quivering. I can see it. Wow. Oh my god, my whole shoe is in her pussy. It's sucking my shoe in.
She's a slut.
She's
dude.
that horny, dude.
Yeah, my dog's horny, dude.
Oh, all right, I got it out.
Oh, she's up now.
Oh yeah.
Stop molesting my dog on the podcast.
I didn't molest her. She tried to suck my
not a
shoe into her
big
pussy.
boy. Is your pussy
her
getting touched,
juices.
big boy?
You can molest my dog at a live show because there's a visual
There
component.
you go. Yeah, you hate getting your pussy touched, huh? Is Stavros sticking his foot in your pussy?
No,
yeah.
dude, she
That's
is.
sad, huh?
She's sticking her foot in my pussy.
Yeah.
Oh, special shout out to the kids over at the Harvard Lampoon for having us over to their castle.
Yep. Thank you for cleaning up the
we did a
molestation
tour
chambers for us.
of their animal house. It was it was a rollicking time. They
I
told
would
us
like to live in a castle, though.
they told us all the celebrities that have committed sexual assaults in that building.
We just dress you up like Bowser, get you a shell.
Hell yes. I would rock. I
Yeah.
would love to look like Bowser.
Let's do it, dude. Let's get you a shell.
I got so many Halloween ideas this year,
Yeah.
man. Is it going to be Thor, Bowser, or John Wick? I
How
don't
about all three combined?
know. Ooh.
Just get you a Bowser shell and then a suit.
Thor, Wick, Zer.
Yeah.
Thor, Wick, Zer. And then throw those frogs in, too.
Yeah. How about you become Nanette and Tigger?
No. I respect the hustle, but no.
Yeah, okay. I was saying the other day, like, what a risky pitch Tigger was.
Oh, yeah. Well,
Like how
back in
it's-
the day, it was fine.
Oh, yeah.
It's one letter.
I know, but, like, imagine trying, you work at Adventure Time, and you're like, how about a character who's a tiger, but he's spelled with 2 G's?
Yeah.
And people be like, Mark, what are you getting at? What is your point, Mark?
Yeah.
It's like nothing. That's just a cute name for a
It's
tiger.
Adventure
It's like,
Time.
why is it a cute name for a tiger?
No, I just
I don't know.
bouncy,
He's
he jumps
bouncy.
really
like,
good.
yeah, it sounds like tiger. It's like, yeah, but why does it have to have 2 G's in it? Why the fuck would that be its name? Explain it to us. Like, look,
yeah,
I
because
just
everyone else is named like Owl and
yeah, Eeyore.
Eeyore, that's not even an animal.
It's just his name.
There's Piglet.
Piglet.
Piglet's.
It's a small pig.
Yeah.
That
It's
makes
got
sense.
the IGA still in it.
Yeah.
Well, I disagree.
the
I think
owl?
Adventure Time would have that name because if you watch it, it's actually for adults. All the jokes.
Look, man, I know you got some sass, but Adventure Time's pretty good.
It's the jokes are for adults.
Relax, man. It's a good show. There's no reason to try and burn Adventure Time.
I've never seen Adventure Time.
I just know that
fun.
people say the jokes.
I don't watch
are for
stuff
adults.
that's for
Flapjack.
adults.
Oh, yeah.
I only like watching stuff that's for kids.
Are you cleaning your nails with a knife?
I am.
What?
Why?
Why do you have to have the blade out, dude?
Does that
Why do I
hurt?
have to have the blade? No.
Put the blade away.
Put your mouth near the... There you go. Suck. Why don't you just go get a manicure? Oh, what are you doing? That looked painful.
No, it's not painful.
Stop.
It's not pain. I do this all the fucking time. I don't know why this is a big deal.
Do you ever get your shit infected?
No.
Interesting.
Yeah, you never jam a knife under your... Oh, that was the other thing we were laughing about. So the Chinese are suing affirmative action. That's the headline. To go to... because, you know...
They want
black
colleges.
people are taking up their spots in college. And we were laughing about what happens when the Harvard Lampoon is nothing but Chinese kids.
Yeah. He's like...
Man break law. They shot bamboo in his penis. Ha ha ha. Yeah. Man get run over by horse cart. Man dick got cut off in factory. Very funny.
Honestly,
very
all
funny.
those are pretty funny. If
Very
they had a
funny.
cartoon with them where the guy's like going, ouch.
This
I
is
would
Chinese
laugh at
Mad TV. Chinese SNL. Because then all the writers get TV jobs after that.
Oh, yeah, that's true.
Yeah.
Every
Just
character is Miss Swan.
The cold open, it's Donald Trump, and he's like, yeah, I fucked my own son. Live, it's Saturday. And the show just starts.
Yeah.
And then there's
Bang, bang, bang.
at the end, there's just no music. They're all just like bowing repeatedly.
They have that guy on as the musical.
Yeah. With a musical guest, the man who smells like piss from the subway.
That's cool. What if MIT had their own Lampoon and it was all autistic guys?
That's good also.
Yeah. And they're just like, it's like dogs playing cards with each other.
Another good one, man.
Yeah.
Dogs playing poker is a good painting.
It's supposed to be people.
That's true. Look, man, I don't appreciate you slandering Adventure Time and then dogs playing poker.
That's what, in The Accountant, right? That's the only piece of art that Ben Affleck
really?
has. He's like, yeah, I like it because it's supposed to be people.
Nice.
And it's actually, if you could see it, it's dogs.
Did you see the autistic man, or maybe he had Down syndrome? He was like 50.
Or in our audience in Cleveland?
No, but yeah, there were plenty of those guys.
The
But no,
flip-flop guy?
No, I didn't see him. The guy who reunited with his 80-year-old
oh, yeah, kissing his dad on the mouth.
Dude.
Very cute.
That shit was awesome.
I loved seeing those two men kissing each other.
I thought it
was very
heartwarming,
adorable.
dude.
Did you see it? You're off social media.
Yeah, I don't see anything.
It was a Down syndrome man he was 56 years old, reuniting with his 80-year-old father after going on vacation.
And the 80-year-old was kissing the Down syndrome guy on the
They were
lips.
just kissing each other.
It was
Bum bum ba-dum, ba-dum, bum.
Ice-T
Bum
just
bum
arrested.
ba-dum, 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 ba-dum. Yeah.
You think his dick is a lollipop? Bum, bum, ba-dum, bum.
How about it just a cold open for SVU or whatever, and it's like, you know, PS 117, you know, Harlem or whatever. It's, you know, I don't know.
Yeah.
Astoria.
Yeah.
And then it's a classroom, and it's a special education classroom, and it's like, okay, kids, like, everybody, I want you to go to the cubby area, and we're going to put on our Velcro shoes now, and then we're going to come over to the block area, and we're going to play with blocks or whatever. And the teacher's like, Michael, what is that? Why do you have a 2-liter? And it's like, Michael, you're not allowed to drink soda in class. He's like, but I want to. And then she's like, Michael, what are you doing? And then she goes over as the music's like building or whatever. She's like, Michael, this isn't soda. And then she reaches it, and the 2-liter is just filled with cum. And the retarded kid's just been chugging cum, and it's leaked. You just cut back to him, and it comes all over his shirt and his mouth. Oh, yeah. She's like, where did you get this? Bum bum ba ba da ba. Somebody's been giving retarded kids 2 liters of cum. Telling them it's Sprite.
That works?
Yeah. Man, that's messed up. Yeah. Bum bum ba da ba da ba da. And then they go to the bottling facility, and it's like, well, there's this new guy, Greg, that works here that's been handling all this stuff. And they're like, this is the piece of shit that's doing it. And then it's like, you know, voodoo, you know, Greg's residence, Ditmars or wherever the fuck, you know.
Yeah.
And then they go to the house, and they're like, yeah, we're here to see Greg. And then they're like, I mean, Greg's in the bathroom. Like, get his ass out here right now. We got to talk to that thick son of a bitch. And then the woman's like, I I don't know what he could possibly have done wrong.
Yes.
They come in the house, and then Greg has Down syndrome, and then Olivia has to look at Elliot, and they're like, oh no. And then we come back, Act 3, we find out that Greg's being forced to drink cum by,
made him.
I don't know, the guy from the newspaper stand.
Yeah. They want to sell this. This is a sensational story. Bitches sneaking
Oh,
jizz
the
to
head
retarded
of
kids. So it's the head of the New York Times has been making Greg drink cum.
For the headline.
For the headlines.
That makes sense.
That sexy district attorney bitch is like, are you going to tell me that if it's over 2 liters of semen, it's not illegal? And the judge is like, my hands are tied. Olivia's like, we got to let this guy walk.
My retarded brother was force-fed cum. Yeah, that's good, man. Write that one up.
Yeah, that'd be a good show, dude.
Rape, I believe.
I saw this
working title.
I saw an episode recently where it was a little boy who was raped at school, right? And then you find out that it's another little boy in his class, and he's been raping like.
That's
every
always
single
what
kid
it
in
is.
the class.
It's like, what if the victim was actually a second victim?
Yeah. And then they go to the kid's house to like arrest him or bring him in.
But he rapes them.
No, he's sitting in his bedroom watching pornography. And then they bring him in and they're like, why did you do it? Why'd you do it to all the other kids? He's like, I want to do it like in the movies. I want to be like in the movies.
Yeah, I remember when I first watched porn, I was like, damn, I can't wait to fuck my friends in the ass. Now that I watched a woman with big tits suck dick, I just want to bend over elders and fuck his ass.
When the Aaron Glazer thing happened, I wanted to do an SVU parody where it's like, like Olivia and Elliot responding to a house, there's cop cars outside and police tape, and going up to the bedroom where a 27-year-old girl who still acts like a 13-year-old has been raped by Aaron Glazer, and she's in her bedroom and she's crying, and Olivia and like Elliot are in the bedroom with her or whatever, and they're like looking over like these pieces of paper, and Olivia's like, Caitlin, did Aaron tell you these sketches were funny? She goes, yes. And then she looks at Elliot. Bum, bum, dramatic look. Did Aaron tell you these sketches were funny?
Is my man still working? He had that commercial. Did he go away?
He's allowed to have commercials, but Nick and I aren't.
That is actually hilarious.
Yeah.
You are better off being literally a rapist than being a host of comedy.
Dude, I told you, my agent said that to me on the phone. When all that shit was happening, my agent called me up. They're like, this will probably blow over. Just like, they're like, they want you to like take down the Reddit and stuff. I'm like, I don't control the Reddit. I don't, And they're like, you have tweets that were used. And we're back, and the SD card ran out of space yesterday instead of finishing the episode.
Which we, in hindsight, probably should have done.
Yeah, because now we're going to repeat a bunch of shit.
I don't even remember what we said.
You said something about Brendan Fraser getting raped. Was that in there?
I don't know.
I think we missed that.
Yeah, that didn't.
That was a great one.
That was good.
But you know what? Who gives a shit? I don't care about this fucking stupid show or anybody who listens to it.
Yeah, fuck them.
Yep.
Hey guys, suck our dicks, guys.
Yeah, fuck you if you listen.
Hey guys, suck our fucking dicks.
Yeah,
man.
if you listen to this show, you should kill yourself.
Lick our fucking nuts and suck our fat balls.
Me likey gay sex.
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 My asshole, my asshole.
I like penis. I like butt cheeks.
Fucking me in my anus.
Yeah, boy.
So
that's good.
That is good. I like it.
That's a good ass riff. Ah, my knee hurts now.
Yeah.
Ah, fuck.
Yeah, your legs are just gonna be problems until we solve this gravity issue. You know what we should do? We should put you in a large hard-on super collider and reverse your gravity.
A hard-on super collider?
You mean a hadron, bitch?
It's a large hard-on super collider.
I would prefer the hard-on super collider.
Yeah.
Because then I'm in a robot suit with a hard-ass dick.
What happens?
I would prefer it if that's what sex was, is instead of not even gay sex, but if you hold eye contact with another man in public too long, instead of fighting, you both have to get hard and then run into each other.
Like jousting.
Like jousting.
Your cocks are the thing.
And then their dicks will annihilate each other.
Whoa.
Like bumblebees.
Whoa. Is that what happens to bumblebees?
No, they die if they sting. But anyways, both of you lose your dick, but then that's it.
So you're saying if you use your cock for violence, it should be like a stinger.
That's all fucking is. And what it does is it doesn't reproduce the species. It just rids you of any kind of existential anxiety.
And then you die?
No, you don't die.
You
continue to live a dickless but peaceful existence.
I would love that. Yeah. Dude, free from my cock, free from all the errors I've made because I'm trying to get pussy.
It's a very simple concept, Adam. Don't throw.
I know. What don't you understand?
It's
man?
very simple.
I just didn't know.
You make eye contact with a man. You get hard.
Okay, I know
you
that
run at him with your hard ass dick.
Well, that's normal.
Your dicks
gay.
explode. You go. What are you not following? Like a bumblebee. What is it that you don't get?
I thought they die after they sting. They just lose their stinger.
Your dick dies, man.
Yeah,
your dick is the bumblebee in this analogy.
First of all,
the dick is the bumblebee.
The bumblebees are
I
way.
thought you are the bumblebee.
No, your
and the
dick
dick
is the
stinger.
Bumblebees
okay, that's what I misunderstood.
Bumblebees have a distributed sense of self, anyways, because they belong to a hive. So for a bumblebee to die, it's not a complete death.
The hive is you, and the bee is your dick.
Well, the hive, because we don't exist. We are social to a certain extent, but. The ego death you'd experience when your penis is annihilated along with that other man's
incredible
is akin to the death of a single bumblebee in relation to the colony.
Okay,
absolutely.
And then the colony is protected. It may be down a member, but they're still making honey.
Of course,
they're still fucking the
honey
queen.
will come out of your ass after this happens.
Yeah,
you will shit pure honey.
Yeah,
that's part of the whole thing.
After you lock
which
eyes
I think
with
goes
that guy
without saying. I don't even think we had to explain that part. That would be awesome though, to just not want to fuck.
Yeah.
You just do crafts. I think I would just go to the gym to like live.
Yeah.
You know, because my only drive is to get pussy. Really, if
really? That's not causing you to go to the gym.
Never. No, it never has.
Yeah.
I mean, a little. It will. I mean, although maybe with my foot and my tooth, I sort of don't want to die. I've sort of realized I really am gonna die in a real way instead of just knowing it intellectually. So maybe I'll get a little healthier. But just like, if it wasn't for wanting to get pussy. That's the only time I ever really lost weight. But once I figured out a cheat code to get pussy toothless without a foot that works and fat as shit and bald, it's like, what is even the point of improving myself?
Yeah.
But if I was dickless, I'm free of those urges. I want to live again.
If you're dickless, you can become a functioning member of society.
That would be awesome, dude.
And it's not about self-improvement anymore. It's about